You don't have to do all these advanced treatments. Just start off doing basic Botox and fillers. Lips would be like a basic filler. Train on that. You can bring in easily 6 figures on the side, working minimal. But you gotta get your skill because it's an art, right? We see people's face. Everybody should not look the same. We're all different. And so you want to complement their face. And so, but you have to spend some time in it. So what I always tell my nurses in my boot camp is like, listen, give yourself a year. Like work on your skill. Yes, we utilize a lot of the skills in our practice as nurses, but the art of it we don't. So like we inject, we just bam, inject. We don't think about it. But now you have to really be mindful of your technique and that individual, their skin, their, all these different things. So give them a year. I say give it a year. You could easily bring in 6 figures. Easy. And that's like not even working hard.
All right, listen, every single week, every episode, you hear me talking about themorningmeetup.com. It's the community. Let me show you what's happening here. Every single morning, Monday through Friday, there's 400 plus people on a Zoom call, right? We're learning, we're talking, we're growing together, and this is you. There's all these people here. It's all these people in the morning meetup. Hundreds of people reading books, growing. We get together quarterly. It's amazing. And for some reason, you just keep looking at, just go to themorningmeetup.com and get in the circle. And then you'll be like way happier. Just themorningmeetup.com. Let's get back to the episode. Welcome to another edition of the Social Proof Podcast, where we find dope people that did dope stuff. And I'm really excited about this conversation because one of my passions, and literally I'm creating YouTube videos now this whole year on helping people transition from their job to their dream.
Okay.
I'm really, really passionate about that because I worked at the Cheesecake Factory, and now obviously I don't work at the Cheesecake Factory anymore,
Right.
but the transition was so important.
Right.
And you help nurses specifically transition from nursing
Yes.
to becoming full-time entrepreneurs.
Yes, exactly. So becoming entrepreneurs in the aesthetic space or the digital space. And the digital kind of came along. It didn't start that way. I was literally trying to help them get into their med spas and starting aesthetic businesses on the side. And
What is a med spa?
Okay, so a med spa is pretty much like, if you've ever heard of spa where people go and get like facials and other treatments, usually it does not require a medical doctor or a medical director or any medical background at all.
For sure.
Versus a med spa, it does. So now your treatments are medical grade. And so there's a lot of different treatments you can offer. But for nurses, it's an easier transition for us because we have the medical skills already. But we just have to find a way to get to work with other providers, medical providers in the state, depending on the state, who the medical provider could be. But we have to find a way to work with them, and then we can have our own.
So a spa is facials, mani-pedi, massages, stuff like that.
Exactly.
Med spa, however,
it's like Botox, fillers, threads, medical grade chemical pills. And
hold on, no. What was the first thing you said?
Botox.
That's where you tighten the face, right?
So sort of. It's a neuromodulator that is injected, and it's to help with fine lines and wrinkles. So we in the med spa space say like we are fighting the disease of aging, but we're gonna lose, right? We know that. But we're fighting it to kind of slow the progress of it.
That seems lucrative. Now, me, I don't care because I'm a man, but there are a lot of women.
Brotox, though, don't sleep on it.
Brotox,
yes,
it's a thing?
It's a thing.
Is it really?
It really is. And it's not just for those of the LGBTQ plus community. It's a thing. I mean, Deion Sanders gets it.
You know what's crazy? When you said that, like I'm like, oh wow, that'd be dope. And then you said it's not just for LGBTQ plus.
Yeah.
I'm like, oh, I don't want that thing. Because it seems like, but you're saying a lot of like men use it.
Yeah. Oh yeah, for sure. I mean, don't you care? I mean, you may not care to the extent of a woman per se, but we're all getting older.
How's my
every
face?
day. Your face actually looks good.
I
did notice when you raised your brows, like there was some horizontal lines, but.
Oh, so like if I.
Yeah.
The wrinkles here?
Yeah.
So hold on. So Botox can take away the wrinkles when I raise my eyebrows?
So you would have to get some treatments over time because
Right.
this is something that didn't happen overnight. But
So
definitely,
there's something wrong with it. I thought that's
it's
how
not wrong.
people's faces
I
are.
don't want to say that there's nothing wrong, anything wrong with it.
Yo, I never even thought about it, but
I'm
raise
not
your
saying
eyebrows.
there's anything
You don't have
wrong
them?
with it.
Let me raise yours.
Yeah, he has a little bit.
Yo,
See, now
mine
he has
is really
less.
bad.
He's the youngest, right? So you're younger. He has less. And
I never realized how wrinkled my head is. So that's not natural.
I won't say that it's not natural. It's just a part of the
Let me see
aging
yours.
process.
You don't got them like my whole forehead changes. Do yours. You don't got no lines.
Well, I got Botox. So let me just let you know, I did. I had them very deep. It's a part of our facial. When we make facial expressions,
That's crazy.
it'll emphasize it more over time. Like you can tell how people express themselves facially based on their lines. And
I'll never see my own face again the same way. I can never like, and now it looks crazy to me because I thought everybody, all right. Okay, I'll put my hat back on. It's all young again. So that's, okay, Botox.
Yeah.
Botox for women. Is it just the foreheads or is it?
No, you can treat like Botox, you can treat a lot of different areas, but generally speaking, especially introductory, it would be like the forehead, in between the brows, and like the lines on the side of your eyes. Yeah.
I can see how that could probably make a lot of money.
Yeah, a lot. And I just want to, for nurses especially, I'm very passionate about us because we work hard, but COVID just took it to another level. Like it put us on steroids. But pre-COVID, we worked hard, like 12 hours running. And to be able to free up some of that time, kind of alleviate a lot of the stress and strain on our bodies, like this is what aesthetics has done for me.
Dang. Yo, this just, I kind of want to get into business now because I understand the importance of like certain vanity metrics.
Yes.
To like people's presentation is super important.
Exactly.
All right. This is one other question. I don't even know if it's got anything to do with what you do. You can always tell somebody who had some work done because their lips. You know what I'm talking about?
Yeah,
you know
but that's not accurate. Actually, you should not be able to tell if someone had work done. They should look like themselves, but look refreshed.
You never had no work done.
I did.
Lips.
I've had Botox. I haven't had anything done on my lips.
Lips. Look, I know. When somebody, especially like, no offense, but like white women in I guess like you go to Beverly Hills or, affluent areas, right. You could tell they had their lips done.
But sometimes people are overfilled. And so there's a difference. Like typically African Americans get filler just to add volume to their lips because we usually have larger lips. But of course, as much as we talk, the wrinkles come in and they kind of deflate a little bit. And so we want like the volume in our lips. And so versus Caucasian women, they typically want to add volume and make them actually larger. So increase their size. And sometimes it doesn't look natural. But generally speaking, you shouldn't be able to really tell. Like unless you know them, then you're like, you look like you rested, you look good. That's what you should say. Not like you had some work done. Then that means you had probably too much.
Okay. I want to see an example of somebody that had lips done and I can't tell it.
So you don't believe it?
You didn't have your lips done?
I haven't had my lips done. It's definitely
I want to
genetics,
see somebody.
but I definitely do Botox.
You know a celebrity that had their lips done is black?
Listen, you can look at a lot of these celebrities and tell that they had some work done. Should I really say their name?
Absolutely.
Okay, I'm going to say the people who, and this is, I don't know this. Let me just say this. This is just my medical opinion. Like Vivica Fox, like she's had work done and then she's been like revised and she looks amazing. We know Jada Pinkett has definitely had work done.
Lips?
Yeah, she's had pretty much everything. She's probably had like a
Okay, lips. I can't tell Vivica Fox if she.
And most of the women on any of these reality shows, they get a little stuff. It looks good on that.
So what have you got done? Because it doesn't seem like you got.
I've only just Botox. So I started Botox probably when I was 41. And I should have probably started at like 35. Because I'm 43.
Are you really?
Yeah. I'm 43.
Oh, yeah, you just sold me. I'm in the business. Let me get there.
Yeah,
what?
I'm 43. I have a 25-year-old, just got proposed to yesterday. Like, yeah.
I thought I was older than you.
I'm
And it was them
23.
wrinkles in my head. That's crazy. All right, so I want to. There's so many ways. There's so many conversations I want to get into. One,
Okay.
how you got out of your job, but I'm very, very interested in this whole industry.
Yeah.
What was the first part of your? Okay, let me ask you this, and you don't have to answer it.
Okay.
So let's just say you don't have to say the year, but last year. Okay, let me just do it this way. What has been your most profitable month for your spa? Well, no, I want to ask you, how much you make last year in your spa?
So last year we made about 360.
360?
Yeah.
Oh.
And that was me. I didn't work that much, especially the last part of the year because I was really ramping up my coaching part of the business.
Gotcha.
So it easily, so like, and we'll talk about this, I'm sure, but like in my training, I give them the blueprint to start off on the side, bringing in at least 160 a year on the side. Only working 4 to 6 hours a day for 2 days out of the week. Generally, nurses work 3 days a week.
Is that somebody, them doing it themselves?
So they have to go through the program, of course, the coaching program where we build it together. And then the blueprint. Like it doesn't take a lot to make money in aesthetic. That's why it's kind of the best kept secret. And nurses will tell you like, I want to do it, but I don't know how to get in. So like a lot of people are not happy with me because I'm giving up all the goods. But it's for a bigger cause because we deserve it.
Yeah,
and
sure.
you know, we need to know that you don't have to work this hard, as hard as we do, to bring in the revenue. Like it's about skill and what quality and value we can add into the market. And so we are highly skilled. We just don't really leverage those skills. And we are able to do a lot with our licenses, but a lot of times we don't know that.
Got it. So what would you suggest somebody getting into first? What was the first thing if you're a nurse right now?
So I always say, I call it the minimum viable med spa. That's kind of my framework. And it's like, you don't have to do all these advanced treatments. Just start off doing basic Botox and fillers. Lips would be like a basic filler. Train on that. You can bring in easily 6 figures on the side, working minimal. But you gotta get your skill because it's an art, right? We see people's face. Everybody should not look the same. We're all different. And so you want to complement their face. And so, but you have to spend some time in it. So what I always tell my nurses in my boot camp is like, listen, give yourself a year. Like work on your skill. Yes, we utilize a lot of the skills in our practice as nurses, but the art of it we don't. So like we inject, we just bam, inject. We don't think about it. But now you have to really be mindful of your technique and that individual, their skin, their, all these different things. So give them a year. I say give it a year. You could easily bring in 6 figures. Easy. And that's like not even working hard.
Process of Botox. What is the process? What type of skill set do you need to do that? What is it?
So it's the neuromodulator. It's a toxin is what we call it. But I say Botox because most people know Botox. But Botox is just a type of neurotoxin, by the way. And so basically what it does is it relaxes. So you have to think about our muscles. Any type of expression, anything, we move, our heart, everything, there is a neurotransmitter, right? So basically it contracts or relaxes or whatever. And so what the toxin does is it causes it to relax. So the reason why it's such a skill with this is because what you don't want is to relax and have someone with like a droopy eye. Or
hold on. I'm sorry, because I want to get ahead of myself until I understand it.
Okay.
Is it a shot or is it a rub?
No, okay, gotcha. So it is an injection, a shot.
Okay.
It's a very small amount. I mean, so small that you are injecting in the areas that you want to relax.
So we take a needle, there's a shot.
Yeah.
So let's say, okay, I'll just be, don't laugh at me, y'all. This is, so like you see, I have these wrinkles.
Yeah.
You would take a shot where?
You would, generally speaking, where your eyebrows arch, up in here, and then the upper part. And what it'll do is it'll pull it back. Even though we think relax, we think it'll go down, it'll actually pull it back. So there's certain areas that you are like kind of no-no zones. And then there's areas that we want to make sure that we inject. And so the no-no zones is like out here, generally speaking, because it can make your eye droop. So it's very, it's simple in the skill, but like the art of it is not.
Oh,
So
for
a
sure.
nurse can do it easily, depending on their state, if they can inject Botox, but they can do it easily, but they just have to have the art of it.
But
And that's where the
you
training
teach the
come in.
art.
I teach the art of the business and how to strategically find the right training, because a lot of nurses go out and they're like, oh, I'm going to train. And then they take this training. So they learn the art, but they're not able to implement it because they don't have the business set up right. They can't find a med spa to work for, so it's just goes by the wayside.
Got it. So I'm taking like
Some
3 shots.
No,
here,
multiple,
here.
several. Yeah. So it depends on the individual. Like I would assess you and all that, but definitely multiple small injections.
Shot in the dark, just so I understand it. About how many will go into my forehead situation?
Probably about 6. But for me, as a practitioner, I always treat the other areas as well, because what you'll find is that if you relax these areas, then the other facial expression muscles will start working. So like I would hit you in here a couple times. Let me see if you squint your eye like that. Yeah, I would hit you over here a little bit. Yeah, so I generally don't do people just focally. Like I look at the big picture and then I'm like, okay, and I have them frown and make all kind of expressions.
What else I got on me? What else?
No, you're fine. Your skin is great. No, seriously, it's
not great. It's not great.
It looks great.
You have great skin.
Thank you.
Because when you get surprised, like, it's not, you know what I mean? My surprise skin is crazy. That's wild. All right, so it's a couple shots here, and it relaxes the skin.
Yeah,
and it
much.
makes it tighter. The muscle.
And
it makes it tighter.
Yeah. Yep.
And how long does that last?
3 to 4 months. And so what's great from a business side.
Yeah, I got excited immediately. Oh my God.
It's great from a business side. So like a lot of people will say like, don't you feel like it's getting saturated? I'm like, do you ever worry about hair salons getting saturated? Like they're right there all together and everybody is eating. So
you got to come back.
You got to come back. So my thing is, because my target market in particular is African-American women. And so we already have this concept that, black don't crack, that type of stuff. And which is true. But we still aging. We can't. Yeah.
I see some black. I mean, it's a cool phrase. Shouts out to my people, but
it's comparative to other ethnicities.
For
okay. And so it is true. However, we still could use the treatment to kind of slow the process. And so what I usually do is I get African American women in. If I could just get them in and give them the Botox, I know they'll be back for everything else.
For sure.
So I don't pressure them. I don't try to like overwhelm them. I just like get them in my chair. Give them some good service. Just be very conservative with them, so because they're always worried about not looking like themselves. Like I don't want to not look like myself. And so once I provide the treatment, they coming back for sure. First of all, for that, and then they're like, "What else can you do for me? What else do you think I need?" And then it's go mode from there.
Long needle, or you just have to break the skin?
Little tiny needle. Yeah,
you just have to break the skin.
Really subdermal, like just barely up under. Now there are some injection points like when you get more complex with Botox where you'll go a little bit deeper, but for the most part, just a little pinch, depends on your pain tolerance.
Gotcha.
Guys are not as good as we are with pain tolerance.
Really?
So yeah, typically, yeah.
That's surprising.
Is it?
Yeah. No,
listen,
y'all be
I used to work at the VA.
Right.
I had big, tall, 6'6" vets screaming for a little insulin needle.
That's crazy. That's I don't even know why I reply, because I am that guy. Like a needle, I'm sitting there like this the whole time. So
exactly.
I hate pain.
Yeah.
But so okay, back to this. So I'm trying to understand this business. You hit me like 6 times here, around here, and then you'll hit me in here, right? Do you charge by the shot?
It depends. So what I have my boot campers do is charge per injection, but your goal is to charge per area. Because as you become skilled, your price point, it should increase. And so you can charge per area, and sometimes it evens out if you just have someone that just needs a lot in that area. But most times you'll make more when you charge per area. But you have to get there first. My thing is, and like I always tell people, get people in the chair, don't have them looking all crazy, but focus on getting your skills right. And then you start to increase your amount that you're going to charge.
Gotcha.
Yeah.
So after these few months, I come back. Because I'll start to notice that it's going back to normal.
You will definitely start to notice it. You're like, oh no, I need my stuff again. Because you feel, the way I can explain it for women, I can't say it for you, but like for women, I always tell them, like, you know how when you get a fresh weave, that's my little comparison. They're like, yeah, and you just feel tight, like your eyes all tight. that's how it is. And then so at about 3 months, you start feeling that face just kind of coming in, and you know it's time.
Listen, if I was going to teach you how to make $1 million, would you give me 10,000? Like if I had a course teach you how to make $1 million a year positive, you're going to make $1 million. Would you give me 10,000? Of course you would. It's no brainer, right? So in a calendar year, we make 7 figures with the podcast. But there's 21 things that I extracted from that you're going to need to launch your podcast. But I only got time to give you 3 right now. One is you need a distribution platform. The distribution platform is what you upload your podcast to. That platform sends it to Spotify, Apple, Google Play, so that your supporters can actually listen to your podcast. You're also going to need a microphone. You need a really good microphone so it's crispy audio. And 3, you need an income strategy. This is not necessarily a hobby, unless you're going to make it a hobby. But I can teach you how I made the 7 figures with these 21 things. Now, the good news is you don't have to give me 10,000. My ebook is only $37, okay? So listen, go to podcastebook.com and get the 21 things that you need. And I can explain it in detail, all the things that you need, okay? Podcastebook.com. Let's get to the episode. Are there any long-term negative effects?
There's always potential risks anytime you're doing any type of medical treatment. However, with Botox, it's like, I have yet to see any.
That's up.
Like
Okay.
it's Botox. It literally it goes away fairly quickly. 3 months is no time. 3 to 4 months is no time. So,
Okay.
but any type of health there is. That's why you have to have a health practitioner.
Got you.
Yeah, on your team.
How long does it take? And I'm referring back to myself because it's like the example that I have in my head.
Yeah.
But like for me, how long would this take? The process of you doing it?
From the time you get assessed to the time you get the treatment and walking out the door is like 30 minutes.
Really?
Yeah. And that's the beauty of it for nurses, because we commensurate like our time that we have, 12 hours with, $800,000 per shift, versus you can have one treatment, 45 minutes to an hour, and make that, and then your profit margin is generally about 40, depending on how complex the treatment is, generally 30 to 40%.
Okay. So 30 minutes. I come in, sit down.
Especially for Botox. Yeah, it's like, it's so quick. Like honestly, doing the Botox will take like 5 to 10 minutes. It's just like assessing you and just kind of educating you on how to care for it, things not to do, stuff like that.
Which means when I come back, it's 3 minutes in and out.
You're good. Yeah. Then it's time to get you on to some other treatments.
Okay. How much would this cost for me?
I would probably give you about 20 units to 30 units.
20 shots altogether?
No, it's not 20 shots. It's 20 units. So it's not equal. It's not a shot per unit.
Okay.
So maybe about 7 shots. I'm just ranging maybe 20 to 30 units.
Yeah. It's an estimate.
Yeah, it'll be like $450.
What?
Yeah.
And how much does the formula?
The formula. Oh, the product. See, so here's the thing with Botox. From a business perspective, Botox is pretty pricey. Okay. You do still get a good return.
Your cost is?
Yeah, my cost for 100 units is about $400, a little over $400.
For 100 units?
Yeah, it's 100 units.
I would need 20.
Yeah, you would need 20 to 30.
So that's 40.
Yeah.
So
about 2.
Okay. Hold on. Because I'm getting excited. So 100 units for Botox cost you $400.
About $400.
I would need 20.
They go up all the time, by the way, the vendor. But go ahead.
How much would you charge me for the 20?
So same, about like 400, maybe 350. It depends. If I've had people come in on a family and friends special where I'll just be like $9.99 per unit. That's a family and friends promo to get people in. That you don't make that much, but you should upsell them on other treatments. And at my shop, I offer a lot of other things too, not just Botox, right? Mm-hmm. So non-medical stuff, teeth whitening, like, facials, other things that you try to upsell them onto. Yeah.
This is dope.
Yeah, it's a good business model.
Now, it does seem like that is a skill, the Botox, but the fact that you can maybe find somebody, because I wouldn't do it myself because I don't know if I have the time for the learning curve.
Yeah.
But it seems like I can find someone who is like into the art or like just likes that kind of stuff.
So I mean, depending on the state, every state is different, but generally speaking, non-healthcare professionals, there's a lot of med spa owners who are not in the healthcare. Mm-hmm. They don't do the treatments. They just make sure they have the right people on their team to do the treatments.
And that's what you teach, yes?
No, I teach nurses and healthcare professionals how to start their own.
Right, but
So
I'm
it's the
saying you teach them
strategy.
how to start their own business.
Yes, exactly.
Do you get into
In
the hiring and
aesthetics.
all that kind of stuff?
No, it's so my particular course is set up for nurses who want. Here's the thing about nurses: they're not about to quit their job. Not right now. They got to see the money coming in. So it's my goal to get them started in it as a side business. Have a suite, not like a 3,000 square foot location or anything like that, and get started. Because the biggest challenge for them is they can always pick up a travel assignment. They can work another shift. They can, so it's like get started so you can see the money. And once you see the money and enjoy what you're doing and the people you're helping, then I know you're going to want to go to the next level. So for me, I'm targeting those people. I'm like all on my Instagram page, basically telling them, listen, another shift, another travel assignment. Like they made a lot of money over these last 2 years, but a lot of them are now begging for half the money they was making over the last 2 years because they didn't invest it. They didn't do anything with it. And so now they're trying to figure out, okay, now I'm ready. But it's like the money has started to decline dramatically. So I'm trying to get them over here. And they're interested in beauty too.
What's your most popular product?
Definitely Botox.
It is.
Yeah.
What's your most profitable?
PDO threads. So threads are basically, you ever had stitches before?
Yes.
Have you ever had dissolvable stitches before?
Maybe.
So dissolvable ones would be like, let's say you get a cut and then on the inside of them, sure, thank you. On the inside of them, let's say they dissolve, and then on the outside, those are the ones that actually get removed, right? So on the inside, they dissolve. The ones on the outside gets removed. So PDO threads.
Inside.
So like let's say you had a deep cut. Yep. So they had to sew you on the inside, and then on the outside, they had to close that up.
Yep.
So the ones on the inside are dissolvable. Yep. They don't come out. That's pretty much what a PDO thread is.
Where do they go?
It depends what you need lifted. It's temporary. It's not long term, but it can last a year. So people who are really afraid, maybe they may not medically be able to get put under, like get put to sleep for a treatment or surgery, they may go with PDO threads. And generally what I do with them is I'm lifting the face. I'm doing that. So like the thread kind of goes in and it anchors, and then it kind of pulls it up. And then if you have like, you want to get a defined jawline, we'll do it here. We'll pull it. So that one is the best because it's like $45, $35 to $45 a thread, but it's highly skilled. So you're charging $2,500. So like an average person, you'll do at least 3 threads on each side. If they're younger, maybe 2 and 3 on the other side because our face is different.
Hold on, because I don't understand the thread thing. Okay. They're dissolvable stitches.
Pretty much. I'm just saying that for lay terms. Yes, they're dissolvable stitches.
Which means you'd have to cut my face open.
No, it's not cut your face open. It's pretty much I would poke a little hole right here, and then I would thread it through this little cannula through, and it anchors, and then it pulls, and the string comes out. So I would do that maybe 3 times, let's just say, in the same port, like the same hole. You have the 3, you tie them off, you cut them, and you kind of pull the face, and then the face stays there.
The face just stays there.
It stays there. It lasts about a year. I mean, and sometimes we'll do fillers with it and other things, but yeah. And so for people who would like get a facelift, like maybe they want a facelift.
I don't understand it yet. I'm trying. Okay, hold on. Let me see. Because this is important. Because I'd imagine, is this a facelift?
It's not a facelift. It's a thread lift.
Okay.
Facelift, a surgeon has to do it, first of all. Yeah. I would not be qualified to do it. A surgeon has to do it. But they literally cut their face, peel it back, lift it, cut off the excess, and sew it. That's a facelift. It's pretty, yes, that's a facelift. So this is a non-invasive PDO. It's a thread lift. And it's the threads that we use, and it lifts their face. It doesn't last as long. Of course, facelift is permanent, but you think about gravity. Yeah. Gravity does what?
Pull stuff down.
Okay, the whole point is to pull stuff up.
Yeah.
If I can simplify it.
So how do you get it in? It's like a
cannula.
A what?
It's a cannula. So it's like it's something that has a hole in the middle of it that has the thread inside there. And so you thread it through to your destination, whatever you're trying to do. Some people have these lines right here. So you want to kind of go a little bit past those lines and you pull it, and that'll smooth out their face.
That's hard.
Yeah.
And that's like $2,500?
Yeah, that one is very profitable. It's
So-
risky. You
because
have
you
to be
only
highly
need the
skilled for
thread.
that. I don't even talk to my boot campers about that. They should be practicing for a couple
You do
years. Yeah. Yeah, I've been trained 3 times so far on it. It's something you never stop training too. That's another thing. So, but yeah, that's the most profitable.
So the
And it doesn't take
cannula
that long
thing,
either. It's like
I guess the cannula thing doesn't cost much money.
I said $45 per. So like if you have, generally speaking, like I said, 3 on each side, that's 6. And you're charging like, and it depends on your work. Like you don't have necessary, because again, everybody is different. So it's not like a cookie cutter recipe. Like you have to assess your patient. You have to see maybe more, it just all depends. And so if they need more, it's fine. You're still going to charge the same amount. But if they don't, you won't. It just depends on what's medically indicated.
Wow. Teeth whitening. Where's the money?
So teeth whitening is a good way. So let me just tell you, my background, I started in non-medical. So I started doing permanent makeup, brows. And then from there, I scaled to the med spa space like 3 years ago. So that's kind of how it went. I was already doing teeth whitening. It's good. You can get a lot of people in. So what I tell my nurses is you want to hire somebody to do that. Especially once you start doing aesthetics. You don't want to do that. But it's good because it's 60 minutes. You charge like $100. Get somebody else to do it. You're paying them on average like $20 an hour. So it's good. And the products maybe cost like $15 per person.
Dang.
Yeah.
Golly.
So you got people doing just teeth whitening who are not in the medical field at all, and they're killing it.
But I can imagine if you come and get the Botox, why
type.
wouldn't you get your teeth whitened?
Exactly. Why wouldn't you get your teeth whitened? Why wouldn't you do the V-steam? Because I do V-steam.
What's a V-steam?
Yeah, who knows about V-steam? Anybody?
What's a V-steam? You know about the V-steam, Mark?
Yeah,
You get a V-steam?
There's no whacking.
It's vaginal.
Oh,
Yeah, the yoni.
vaginal steam.
Yeah.
I won't be able to hear you.
On your podcast?
Who? There's a what?
I forgot her name. She has
Oh yeah, Star.
Mhm.
Wrong girl, yeah. So
Yeah.
okay. So that's the V-steam.
Yeah.
Explain the V-steam.
So it's pretty. First of all, I want to preface it with it's controversial. You'll hear some medical doctors like, I don't agree with it. I actually do agree with it, and I use it. So by the way, so I'm speaking for firsthand as
Use
well.
it yourself or use it for
myself,
clients?
and I
Gotcha.
use it for clients.
Okay.
So I totally support it. That's my experience. So I feel like I can stand by it for my
Yeah, for
clients. So the V-steaming is basically, a chair, in my setting, I have a real nice custom chair just in a room where it's like really just kind of, just a good aura in it with the water and the right music. And pretty much you have herbs, a lot of different herbs, magnolia, ginger, like a lot of different ones in this blend. You heat it and it steams and comes up, and you just sit.
So you sit in a chair, and I'm imagining the hole is out of the bottom of the chair.
Yeah.
You put herbs and stuff, and you heat it up kind of like to a boil.
Yeah, but you don't want it to be too hot because you don't want to burn anyone. So
Gotcha.
yeah, but you heat it up to the point where there's steam. You want steam.
And I guess their legs are kind of open, so it
Yeah.
kind of gets the whole situation.
Mm-hmm.
And what does the steam do?
So the herbs, there's a lot of health benefits with it. If you have irregular menstruation, it helps with that. Vaginal, I don't like to use the word, I'm in medical, so treatment, you won't hear me say, but like it helps manage symptoms of BV, bacterial vaginosis. It also helps with vaginal dryness. So there's a lot of benefits that people have had as a result of it, I would say.
You V-steam? You be V-steaming? You've never V-steamed? What is the thing that people don't agree with it?
So
Wow.
a lot of medical doctors talk about and typically, so you have to realize we are in a westernized country. And so we've been taught medicine. So when you veer off into like holistic and herbal, they're not having it. Okay. But one of the things is burning. Like it is true. If you have to have someone who is knowledgeable of this. Ideally, if they had a healthcare background, that would be even better. But you have some people coming out here just starting these businesses. They're not properly trained and they're burning their clients. And, that could be a very bad
Yeah,
thing.
for sure.
Yeah.
So
So,
simply too hot. pretty
yeah,
much.
pretty much the burning, and then that they say that there's no scientific support for it, which this is medically from the medical side, right? There's no medical studies that has supported this, but there's really no medical studies that has even studied it. But
So steam goes up. Is there like a dripping, sweating, perspiration, or like you see some sort of stuff come out?
no,
We're gonna
no,
talk about
no,
something
no,
else.
no, no. Typically not. Nothing should be coming out, but it is steam, so you may have the condensation, but there should be nothing coming out. If that's the case, they need to go to their OB, check that out.
It's weird stuff going on.
Yeah.
Okay, so I want to know about your transition. You're a nurse for how long?
So I've been a nurse for 14 years.
Mhm.
I actually I worked at the VA. I worked there for full time until I couldn't do it anymore. And I started my transition after about 3.5 years at the bedside. And I thought I hated the bedside, but it wasn't the bedside. It was like the environment that I was working in. So I started my transition. I literally was sitting in my car for a month, probably crying every time I had to work because I did not want to go. And I had went through all this schooling. I have my bachelor's degree from USC, my master's degree from UCLA. And I was like, I didn't go to all this schooling and all this debt, and I'm like literally crying. But my mom, who she was trying to support me in the best way she could, and she's just like, I don't understand. Like, you're making all this money, like you have a good job. I would, and I'm just like, and so she's like, stay there. Like, you got benefits, everything's benefits. You got all these benefits. And then it was just one day I was sitting in the car and I was like, I'm done. I walked in, pulled the paper out from the printer, wrote my 2-week notice. I had no plan. I didn't know what I was going to do. Kids, recently separated. I was just like, I'm going to figure it out. And I started working in education. I worked in academia. Like I said, I've been doing that for 14 years, but I started at that moment in academia once I got hired after a couple of weeks. And it's just been transition. I did doing that. Love it. I absolutely love academia. I will say that. But does not pay enough, it wasn't in alignment with what I wanted for myself. Sure. So then I started working per diem at UCLA. Shout out UCLA, amazing organization. Per diem is like part-time, but it's not part-time. It's like 4 days a month typically. Okay. You commit to that. And so the beauty in it is that you have the flexibility to set your schedule. They pay more because it's not benefited. Yeah. So you get great hourly wages. And UCLA is just, one of those organizations that really supported their nurses, does support their nurses. Like you're able to take breaks. You're still working a lot, still working like a dog, but it's just different. And so I did that for 8 years. I was doing that.
Wow.
Yeah. So I was doing that, teaching, and then I was house soup part-time for my benefits. And then finally, I was house soup for 5 years, and I was just like,
house soup?
So yeah, I better explain that. So in nursing administration, there is a role called house supervisor. And basically what we do, there's a unit manager, typically our director, different terms, but for every unit or for multiple units, there's one top person. And so when they're off, and because they have 24-hour accountability, I'm the one over all the units over the hospital. On weekends, nobody's there typically but the house soup. So if there's a code, we generally are very involved in the code, patients, difficult patients, staffing, moving patients around the hospital, whatever. So I did that for 5 years. But just one day I walked in and I was just like, I can do this with my eyes closed. It was great. I love my team. Like everybody, honestly, it was in Compton. Yeah. So I worked there, it was giving back. It just was great. Like everybody understood me. There was no code switching, but it was something I could do with my eyes closed. And I just was like, yeah, no, this is not it. And so I decided to resign there. It's funny because I was staying there for benefits because I was always told you had to work full time to get benefits. But it's amazing how resourceful you become when you make a decision. So I'm like, I'm seeing all these entrepreneurs out here. I know they got to have kids and they take care of their kids too,
sure.
So then I started looking it up and I'm like, And I'm in we here in LA, and we have ways that you can pay for your own. Literally, for my entire family, we pay like $300 more than what I was paying already.
It's wild. It's funny because most people, before they quit their job, that is the number one excuse.
Yeah, I know.
Not excuse, but it's number one reason. It's like, oh my gosh, what am I going to do about insurance? And you can pay for it.
It's deep rooted though. You got to understand that.
I want to invite you to pick my brain.
Mine too. Mine too.
Yours too?
Mine too.
Yours too.
I can
Okay,
pick
you
my
guys, we are so excited because we just dropped our newest podcast series called the Brain Picker Podcast. David.
Oh, it's going down. You get to pick our brain. You have a business idea, a concept, you're stuck, you can't get off the ground. You need the advice of seasoned, experienced entrepreneurs. Not only entrepreneurs that are practitioners, but we got a lot of people that we've been coaching all over the last decade.
All over the globe.
They got receipts.
Not just that, you never know where your next investor might be hanging out. And the word on the street is we got all the connections.
That's a big fact.
We got all the connections. So if you want to sit down with us and pick our brains
in front of our audience,
and we're letting you pick our brains, we won't even talk bad about you for doing it in front of our audience, bringing your business maximum exposure. Find the link somewhere around here, wherever you see it.
It's there.
And apply
right now
to pick our brain.
Let's go.
Let's go.
Let's get it.
Let's get it.
Like we are, you hear it all the time out on the social media streets, like we are our ancestors' wildest dreams, but this is a big deal, to have insurance and like have retirement. This is what they worked for.
Explain this deep rooted.
Yeah, it's what our grandparents told our parents told us, and their parents didn't have the opportunity to tell them. They were telling them you were lucky if you could. So it's a cycle. And so when we dare to break that cycle or to be the outlier, it feels wrong. It feels wrong. It's like, that's not, that's wrong.
Man, that's interesting.
Yeah.
That is interesting. Because I now I'm starting to think, I wonder why people are so apprehensive as if insurance can only get had if you have a job.
Exactly.
I'm gonna do some research on that.
Yeah.
Okay. So what prompted you to leave though? I mean, what business are we gonna get into? What?
I had no idea initially when I made the decision. I knew the life I wanted to live. And I knew I was working 3 jobs. Like I was doing, like people would say, I was almost at 200,000. And people would say, girl, like you are killing it. But like I was killing me. So like I was missing time with my kids. I was missing time with my husband. I was missing time with my family. I'm like, yeah, this is not it. And it wasn't like it was abundant. You know what I'm saying? Like, so I knew if I wanted to, at first I had to deal with my mental stuff too, like feeling guilty. Like I said, I'm from LA, I'm from South Central. Like, to be able to make the money I was making at that time was like an anomaly. You know what I'm saying? But how dare you think you're gonna make more? Like, you know what I'm saying? And work less. Just didn't add up and so I had to unpack a lot of that first.
Yeah, for sure.
And then as I was doing that, I was like, yeah, okay. So I knew that I that whole money don't grow on trees. You got to work hard. I had to unpack all of that, get that out, deal with that. And I'm not going to say it's still not there, but I have a toolkit is what I call it. And so I dig into my toolkit when I need to help me keep pushing forward. And so once I decided, I went ahead and gave my notice. But at this time, I had already had my permanent makeup business. I was doing really good in permanent makeup.
Permanent makeup is just
like brows.
Brows, okay.
Yeah, like you put them on permanently, semi-permanently.
That's
yeah.
permanent makeup.
Permanent it's like makeup. Tattooing, but for your brows.
What's it called?
Well, ombre brow is what you hear. You hear powdered brow. Yeah.
So it just is that permanent?
Yes.
What you're wearing right now?
Yes. Yep. And you can make good money. I still do permanent makeup. I charge $650 and it takes me like 2.5 hours.
What?
Yeah. So it's still good money. Some people out here charging $1,500 and it takes them 2.5 hours. So
you do your own?
No, you can't do your own. Have someone do me.
Gotcha.
Yeah.
Gotcha.
No, you can't do your own.
So you started in the permanent makeup space.
Mm-hmm.
How much would you make? You were making good money.
Oh yeah, I was making multi-6 figures. So generally speaking, at this time I was probably charging about $400 per client.
Hold on, while you had your job or after?
Yeah, I was which is the next thing.
You're
Like,
a nurse and you're still making 6 figures on the side.
yeah, I was killing myself though, like for
Wow.
real. And so what happened was I'm like, okay, this is really good money, like, but I still couldn't let go because of the benefits.
That's crazy.
The benefits.
Them benefits.
Them benefits.
Golly.
$300 a month. $300 a month. $3,600 a year is all I make pay
Yo,
for.
benefits are the killer of dreams.
For
Golly.
real. Yeah, it's true. It's true.
Because I've witnessed some people where they're doing really good on their side business, but because of the job and the benefits,
Yeah.
they keep the job, which every day you keep that job, it's killing your business.
Yep, it's right. Honestly, that's so true. It's like when I finally stepped away, like officially, I made double, like
Every
for
time.
6 months, the last 6 months of the year, it's just like, oh, but it was really in the way. And you think it's not, you're like, nah, I'm handling it, I'm just, but nah, it is.
Yeah,
It is.
100%.
Even just your creativity,
Mhm.
your ability to dream and visualize what you want, you can't.
Yeah,
I don't care if you're just sitting at a desk, not even doing nothing. It still affects you.
that's real. Outside of the permanent makeup, what was your first med spa thing?
So IV hydration. IV hydration is where I started.
All right.
And so that's not considered aesthetics. That's more wellness.
For sure.
So I started an IV hydration business.
Did you make money in IV hydration?
Oh yeah, you can make money in IV hydration. It's a really good business because you can have multiple clients. I mean, all you doing is once you're sticking them, the fluid is running, you're assessing them, making sure they're good. But you can do multiple people. The work is in putting the IV in.
So I had a meeting with somebody, and they were in the IV hydration thing, and I think it was kind of like me investing in the business.
Mhm.
I just couldn't see the money.
Yeah.
I just couldn't see it. Well, one, I couldn't see the money, and two, the learning curve. So LA is different.
Yeah.
Because everybody's familiar with it.
Yeah.
Not everybody, but
Well,
people are
it
more
started
familiar.
in Vegas. So everybody out here knows about the IV hydration, generally speaking. But you go to other places, they're like, what?
What is
Why
that?
would somebody want to get stuck? Like, that doesn't make sense.
I hate needles. And I was like, maybe I'm the wrong person to invest
'cause
in
you hate
because, I hate needles. So it'd be like, I literally can't sell that.
Yeah.
You know what I mean?
For sure. And everything I do in my business has to be something I stand behind. Like I support it. So either I have done it, I use it, or know somebody who have, or it's just a strong, but honestly, there's nothing in my business I haven't done.
Do you take IV hydration now?
Every single month.
Really?
And injections. Yeah.
Botox.
No, not just Botox, like vitamin injections, like B12. Yeah.
Oh.
Yeah. For sure. It really, you need it. You do.
It can't. Yo, if there was a way to do it where it could be like a patch on my arm and my body absorbs it without getting stuck, I'd be like, ooh, this is a business.
Yeah.
I can't
No,
do
you
the
gotta
needle.
get stuck.
I can't. I don't know a nicotine
Oh.
patch.
Yeah, but B12.
But B12.
Mm-mm. I guess chemically it would have to be able to go through your skin. And that's the challenge, because there's vitamin pills you can take right now.
Mhm.
But the problem is it has to pass through your stomach. And you typically excrete a lot of it either in your urine or in your stool. So you don't really get they call it bioavailability. Like you don't really get it in your in your blood. That's where you need it.
You have one med spa.
Yes.
Do you plan on having more?
Absolutely. My goal is to franchise for nurses. Like I want to really create a good business model, solid, like to help nurses get in this space, especially.
Do I know a nurse? I want to talk to a nurse about, any nurses? I want to talk to a nurse
Yeah, I do.
about, who is it?
My aunt.
She's not,
Call her right
she like straight nurse, or she doesn't like,
Straight nurse.
I call her real quick. Cause I want to know, does she know about this? This is like the thing that could set her free.
Yeah, she probably does.
She
just
started as a
started?
nurse?
Yeah, like a year ago, like during pandemic.
Yeah.
Yeah,
She
she's
just
still-
started as a nurse, or she started as a entrepreneur?
Nurse.
She graduated and passed her NCLEX. Okay.
Gotcha.
Yeah.
Oh, that's dope. All right. While Mark gets her on the phone. Your first, have you ever had any droopy skin? Like you ever hit somebody wrong in the beginning?
Oh, you mean like, so what I've done in the beginning is Spock brows I've done. And so Spock brows is basic. It's easy to fix though. It's basically when they
You look like
express, they
Dr.
have like,
Spock.
they like, yeah. And so what you do is you just hit them with 2 units on each side and it'll come down. But it's good. It's better
But
to,
hold on, I thought when you hit them with the joint, it goes up.
yeah,
instead of-
but so everyone's muscles are different, right? And not everybody Spocks. So for me, I always go conservative and then I can add,
Mhm.
right? So they come back in 2 weeks. I'm like, all right, I think this could use a little bit more. You still got some lines here. We can work with that. But if I overdo it, I can
Just
droop
wait
them.
for it to come
I
back.
can't do nothing for the drooping. Like I can't, there's no antidote. So if I droop them, they got to wait 3 months. So I would rather them Spock and then I could just hit them with 2 on each side. That'll bring it down.
Hold on real quick. I'm sorry. So a little bit, bring it up, but too much, it brings it down.
No. It just depends on their facial anatomy. So like generally you would stay where their arch is within that area. I'm just speaking this very lay term, but generally you stay where their arch is within that area. But some people you may have to kind of go a little bit outside of it if they Spock, but you really won't know until you treat them, and then when they come back, you'll see if they do or not. There are some ways to some little techniques you can use to try to see if they're likely to do it, but you really don't know. So what you want to do is you want to go conservative. If they do, you can just come back and give them however many units. I say 2, generally speaking, but sometimes you may need to do 3, but you don't do a lot. And that's going to bring them down. But if you assume they're going to Spock and they don't, then they may droop. And then you got them looking crazy and there is nothing you can do about it.
Gotcha. So at first you be spocking people.
Yeah. In
Right.
the beginning, it happens. It happens to the best of us.
Yeah, for sure. That's good. What are all the services that you have at the med spa now?
Oh my gosh.
Let me see. All right. Well, tell her. She's gonna be like, yo, who's this? Tell her. Hold on. But you'd have to. All right. Come to the mic.
Hey, what's up? She said, yo, what's up? You're about to be on a podcast real quick. They have to ask you a question. Cool.
So,
She's all
hello. I'm sorry. What's your name?
Hi, my name is my full name or
Just your first name.
She's so
Cassandra.
Okay. Hold on. His phone is Auntie Cece. We can't.
Well, yes, I do have a couple other names.
Okay.
But
All right. I'm gonna call you Cece for right now. Is that cool?
yeah,
All right. So you're a nurse, right?
I am a nurse.
Have you ever thought about administering, or creating your own med spa in terms of Botox or vagina steam
or IV hydration.
or IV hygiene?
Yes, I actually have.
Really? What would be
I
your?
just recently got a job in the emergency department, so I've been doing IVs a lot more. So I thought more about doing like IV,
So you should
fluid
follow me on
administration.
Instagram.
All right. Hold on, let me ask this question, and I'll ask her. What would hold you back from starting your own business in this space?
I don't know. I guess just barriers of starting a business. I've never started a business, so I guess that would probably hold me back. I don't even know the first thing about starting a business, to be honest with you. But I don't know.
All right, I'm about to have somebody coach you real quick, okay? Because she is absolutely killing. She has a med spa and she teaches other people how to get into the med spa space and really start to kill it. She is full-time entrepreneur, but she was a nurse for a second. So she about to coach you real quick, okay?
Let's do it.
All right, let's do it.
Okay, it's Cassandra, right?
Cassandra.
Hey, Cassandra. So listen, I actually want to, in addition to what I'm about to tell you, I have a webinar that I want to give you for free. It's going to give you all the insights on getting into this aesthetic space. Okay, so we're going to reach out to you. You're going to give her your number. We're going to reach out to you and give you access to it, because a lot of times nurses that's the biggest challenge. Like, we've never been in business, fear, money, of course, money, and just don't know where to start, right? That's generally why. Okay. And so what I want you to do, I don't know if you're following me or not yet, but you could go to sidepreneur_nurse.
Hold on 1 minute. I'm right here. Sidepreneur.
SIDEPRENEUR_nurse.
Okay.
All right. And then go ahead and follow me. Send me a DM. I'm going to give you that. I could give it to her in a DM too, right? under my DM. Okay, I'm going to give you that. But what I want you to do is go ahead and look in your area and see if there is any type of trainings in your area for nurses. Okay. Mm-hmm. And then look in your area and see if there's any nurses who actually own aesthetic businesses in your area. A lot of times it's state specific, right? Okay. So the question becomes, who do you need on your team, if anybody, to make it happen? Yeah. Okay. And then once you do that, look at the video. Make sure you look at the webinar and then get back to me. I think she could benefit from the boot camp for sure.
Oh, word.
Yeah, for sure.
Why do you think she's afraid? Or why do you think she hasn't started? Yeah.
Fear of the unknown. Fear of failure. I did 14 months of free discovery calls from 10 a.m. to 2 p.m. every single Monday, talking to nurses about why they're not starting. That was my market research. Fear, and the fear is of the unknown. Can I do it? You're looking at other people. They seem like they have it all together. You're like, I don't know where to start. Another reason is the medical director. They're like, how can I find a medical director or a doctor to collaborate with me on this? Money. If you look on Google, it looks like it's like $250,000 to $1 million to get started. I teach my nurses how to get started in like $15,000 or less. But I also have a business credit masterclass where I'm teaching them how to get that business credit so they can use OPM. So that's money is another reason, right? Mm-hmm. Yeah, money. Yeah.
CC, we gotta get you right. We got you. Yes, listen,
thank you.
You are a boss, all right? So you about to run your own business.
You could do it. Listen, I always say the nurses who worked in COVID, like y'all get an extra 3+ bonus years. Because it's a whole different beast.
Absolutely.
They did not prepare you. They could not prepare you in nursing school. Nothing could have prepared you for that. So
yep,
that's a fact.
That's right.
One, I want to say thank you for your service too, and I can't wait to see after you connect with Dr. K and we really get you rolling. Okay, and Mark will be on you too. He's gonna be checking on you. All right. All right, Cassandra. Thank you so much.
Thanks, Cassandra.
All right, no problem. All right. So, I don't think we can close it out no better than that. Yo, this is awesome.
Yeah, it's dope.
So what you mentioned something like you can get people started with 15,000 or less.
Yeah.
What are all these fees?
So they're going to have to invest in bringing somebody on to medically direct it. And it depends. So nurses are also nurse practitioners. And in some states, nurse practitioners can practice medical. They have autonomy. So it depends on the states. In the state of California, that's not an option at this point. So we have to have a medical director who we work with. And so there's fees associated with that. Of course, location. If you're doing something like Botox, you can do that concierge, meaning, you don't have to have an actual location in some states, not all states. So if you start off doing that, that's even a lower cost. But generally, that 15 also includes your suite. So you have to have a location. Okay. And the more complex your treatments are, you definitely want to be in a location in case anything goes wrong. So you want to make sure you cover yourself on that. So it includes that. The trainings, you have to get trained and train. That's one thing we do a lot of. And then also like your insurance, a lot of people don't know though, like the real lick is that a lot of nurses are out here like spending all this money on training. But when you get with these vendors, these pharmaceutical companies, they will train you for free. Wow. You have to do your first because you're going to buy products from them. Sure did. But you have to get your first couple trainings under your belt as a newbie. Like they don't want to be training you about facial anatomy. Like you have to have an idea about it and have trained some. But like once you get to the advanced, they'll train you. They'll send you. They'll have you going to different locations, training with other physicians and other nurse injectors. But we don't know that. And so that's another thing that I tell them when they join my bootcamp. I'm like, don't train yet, not yet. Like, because you are going to get a lot of training from these companies, these pharmaceutical companies for free. Because the more money you make, the more money they make.
For sure. Makes sense. Butt shots?
I don't do that yet.
You would though?
I would do hip dips. And hip dips are something that I'm actually passionate about because I want to get my son.
What are hip dips?
So hip dips is like where you kind of curve in a little bit, like at your hip area. And so you just kind of want it a little rounded out, just a little bit.
Hip dips.
You really wouldn't know it. I would know it and people in the industry know it. But hip dips is what it's called. And basically what you're doing is you're kind of building out. So like natural butts, and no shade to nobody who don't have it, because I'm all for it. But for natural butts, we generally have like a little curve in. It's not perfectly, the hips don't just stick out generally.
On the sides. Like if you're looking at a woman in the front, like that.
On the front? So if you're looking at her, you looking at me front ways? Is that what you're saying? Or are you looking at me from the back?
I'm trying to ask what you're talking about.
I know. So are you talking about I'm trying to describe it from the front. So looking at me from the front, kind of just like right at the hip area, just kind of concaves it just a little bit. And so there's
at the top of it.
No, just right in the hip area alongside of the butt.
Why would you want a concave in your hips?
You don't want a concave, but some of us do have that. So we just want to fill it in a little bit. I see.
So you want it, when you're looking at someone forward, you want it to come out, just add a little meat to the sides.
Just a little,
okay,
yeah.
I got you.
So when you said about the butt shots, like I definitely have that on my plan to train on that.
Safe?
It is, pretty much. I mean, there's always risk. I mean, anytime you're injecting something what you would use for this is something called Sculptra, which is a more sturdy type of filler. And so there's risk. Like if it gets caught in a vessel or something like that, you could be in trouble. But the technique that is used, the risk is really, really low, because you're not using a needle, for example, using a cannula, and you're
cannula.
Yeah, cannula. Remember I was telling you the thing that has a hole in the middle?
Yes.
Yeah. So you're using a type of cannula. And you're filling it in. So, but there's always risk. There's pain, unfortunately, but people have good results.
And I can't say the person's name because I absolutely love this person. It's a celebrity.
Mm-hmm.
And I never know when I'll be able to meet her. But just beautiful. But over the years, you can see more and more face stuff. And like the face just gets so...
I know.
What do you think that's a result of?
It's over. You get a lot of... You see people from before and you're like, oh my God, they already looked beautiful. Why did they? But I think Hollywood is just a different beast. You know what I'm saying? And they start to see it become normal. I think there's a mental part to that, because you start seeing everybody around you with it, and then you're kind of feeling like you need it. You know what I'm saying? But it is the result of either being overfilled, like just having too much work done, and it really starts to change their face.
It's crazy, because she had nose and lips, and I'm like, yo, you are so beautiful.
Yeah.
And now you're your face is just so doctored. You know what I mean?
Yeah. And, beauty, I mean, sometimes, you have women, they feel good about themselves with that. And so and I will say this about women, because I love aesthetics. So y'all don't come for me, please. I really love aesthetics. Okay. I'm not a hypocrite. I just feel like, some people, they see themselves one way and we see them differently, and they want to look the way they want to look.
What's more important?
Oh, how you feel about yourself.
Okay.
Forget everybody else. For sure.
So she might love the way she looks.
She might love it.
In my perception,
doesn't matter.
Would you do that? It doesn't matter. It really doesn't matter.
Facts.
Yep. Goodness gracious.
Mm-hmm.
And people got the overly butt shots, and your thighs is mad little. And I'm thinking,
listen. I'm about to stop you, because they gonna come for you anyway.
I'm speaking my truth. But my point was,
that's not your truth.
It is my truth. Huh?
That's not your truth.
No. My perspective is. But here, okay, let me finish the statement.
Okay.
So I see, it seems like it's overly done, and then your legs mad little, and it's that doesn't look natural, but maybe some people, they get a certain reaction. Some people like it. That's just I have a different preference than what someone else has. Yes. So that's where I was going. That is my truth. So. Go ahead.
Y'all look beautiful, by the way.
Yeah, for sure. For sure. Yo, you know what's so crazy? And this really makes sense. So I keep my hair really low because my hairline looks crazy.
Okay.
But every now and again, I'll grow I just can't get a haircut and it'll grow out. And my wife is like, why don't you grow it out? I'm like, are you serious? My hair, chill out, Mark. Your face is...
He's kind of laughing hard.
Yeah, you gotta chill, Mark. Yeah, when I said it, he was like, "Well, she said it." So, when I see it, It's
Mhm.
like, no, I gotta keep my hair cut because
Mhm.
the more my hair grows, the more my hairline shows. You could see it.
Mhm, mhm.
And it's so crazy because my dad used to have like it bad. I'm like, Dad, your hairline's crazy. And now I got my dad's hairline. But she looks at, and I'm always trying to understand. I'm like, yo, is she saying it because she loves me as a husband? Or like, and she always says, she's like, you just let it grow out. I'm like, yo, you don't see my hairline? She's like, it looks nothing wrong.
Yeah.
So perception,
Yeah,
right? So I don't think
exactly.
I look good,
Yeah.
but beauty is obviously in the eye of the beholder.
Yeah, absolutely. Absolutely. I think, I met you before
When?
at ET event here, must have been 8 years ago.
It was a while ago that we were speaking, right?
Yep,
Yeah.
downtown. I don't know if you had hair then. I know you had a hat
I
on.
had a hat
so-
on.
Okay.
You know why?
Why?
The hairline situation. It's me and my self-consciousness. And I didn't realize now that I had the wrinkled forehead. Now
Oh
it's
my
extra.
goodness.
Oh my gosh, I'm wearing headbands from now on. Golly. That's crazy. I never saw that before until you pointed
It
out.
looks fine. Please don't. It looks fine. You asked me that question. I wouldn't have just came up like, hey, David, yeah, you need to get that. I
Yeah.
wouldn't have done that.
I thought I had the most normal head. Like, forehead. That's crazy. Anyway, you were about to say something, I think, and I went on a tangent of
What
my
was I
own
about to say?
situation. I don't know.
don't remember. I was talking about just we were talking about
Everybody's
nurses.
beautiful, and even if
Yeah. So everybody is beautiful. It really is in the eyes of the beholder. I definitely am a firm believer of if it's something that you can fix and it doesn't put yourself or other people at risk, why not?
yeah,
If it
no,
makes
for
you feel
sure.
better about yourself,
Mm-hmm.
do it.
Yeah.
Yeah.
Are you gonna get butt shots?
No, I don't need it. I don't need it.
Oh, okay.
If I did, maybe. But I may get my hip dips done one day. Who knows? I
Mhm.
probably won't. But if I decided to do it, I would.
Married, yes.
Yes, I'm married. But if I needed it, I would. But I don't need it. Thank God.
Yeah, I guess your husband.
Thank
you know,
God.
yeah. What if your husband was like, yo, well, do you have a husband, wife?
I do. I have a husband.
I don't know. So
Good
what
question, though.
if he was
True,
like,
true.
yeah, I want you to get some shots. You would consider?
Hell no. No. That would be no. And ladies, don't do that for your husbands. They shouldn't even. They should love you just as you are. And if you want to change it, love you as you become or whatever. But no, my husband wouldn't do that.
Right.
He wouldn't do that.
So okay. Oh, we gotta go. But that's a whole nother conversation for a whole nother day. How do you approach your spouse with something that you like?
Typically women will know what their husbands like.
Not really.
Well, you should be able to know because your body, you may not tell them like, hey, I like fat butts, but
Yeah.
you will look a little bit second or two longer. You'll let her know.
I had a friend, it was something about his wife, and I don't know if you ever told her, but how do you
No. No.
You don't say anything.
No. That is like,
That's not
that will
fair,
make
though.
somebody so self-conscious. You marry me as I am. And even if I want to get it, don't say, yeah, babe, hurry up and get it. Like, you know what I'm saying? Like, just be like, oh.
So I thought,
honey.
remember them shots? You said you go get some shots,
Just
right?
be like, hey, good. If you want to, babe, whatever you decide. That's the
Okay.
best answer.
Good.
But you do not want her to feel self-conscious. Because
Yeah,
that
I
would be
feel like-
open up a whole nother can of worms.
I love my wife exactly how
The
she is,
period.
but yeah, I can understand the approach of a conversation. And my wife has no problem telling me. Sometimes I'll cut my beard real low. She's like,
See, that's
babe,
different.
grow that beard back. I'm like,
But that's
I'm gonna tell her you should love me as I am.
No, because that's different. That's within your control. That's like a 2-week cut. You know what I'm
For
saying?
sure,
Versus, babe, you do got a flat, or your boobs are this. No, that's something God made us how we are.
Yeah, for sure.
So I would don't do it, guys.
I'm gonna tell her, you said,
Don't do it.
don't tell me nothing about my beard. Okay? I like my beard
That's
low.
not what I said. Tell them about that beard.
I love it. Look, man, we got to get out of here, man. Thank you so much. This was awesome. I really enjoyed this conversation. And I'm really thinking, like, I am like a super entrepreneur. You have no idea. I mean, out of all these like businesses that I
Yeah.
hear, this is one that, it's needed. It's
Yes.
recurring.
Yes.
No one's ever going to not want to improve the way they look.
Period.
Ever.
Business and you would have thought COVID, people would have been like, oh, we're on no, it's shot up. Like it's a good business. We care about how we look.
Absolutely.
And we're on social media all the time.
All the time. With filters. With a permanent filter. Well, this episode is sponsored by The Morning Meetup. TheMorningMeetup.com is the only organization that gathers every single day. Did you know there are hundreds of entrepreneurs that I teach and my friends teach, and you'll probably come on
I would
to
love
speak
to.
and teach to these entrepreneurs as well. But we're on every single morning, Eastern time, 8 a.m. West
Which
Coast,
is 5. Which is the only reason I'm not in it. By the way, I know some people, I'm in the network, so I know people who are in it. They absolutely love it.
Yeah,
but woo, baby,
we got a big West Coast following. West Coast team.
Yeah. Maybe we need to have one that starts at 8 o'clock West Coast time. Y'all missing. We killing it out here in Cali. Y'all, we really feel left out. I know we're not talking about that, but I just wanted to say that.
Wake up earlier.
5 o'clock.
Oh, but you want me to do a whole nother call?
Yeah.
You have not, because you has not. Well, look, man, go to themorningmeetup.com and enroll. So please, Dr. K, let everybody know how they can find you, how they can connect with you, and then close us out with a word of wisdom.
Okay. You can definitely follow me on Instagram at Sidepreneur, SIDEPRENEUR_nurse. I'm pretty big on Instagram, not really leveraging those other platforms yet. So you can follow me there. And then also, what's our site for here? Because we have for our program, we're going to do our masterclass. We're going to offer it. And what's the Lux Beauty Academy /
Yeah, it'll be in the comments.
It'll be in the comments.
Mark, put it in the little thing, like on the screen. Yes.
Yes. Thank you. Good.
We got you.
So what we have is a webinar that we always start with. So with my courses, not everybody can get in my courses. They have to go through my webinar. Just want to make sure they're a good fit and that I can help them. Sure. And so we offer webinars every other week. You can see that. It's also in my bio.
I love it.
Yeah.
Good stuff. Well, close this out with a word of wisdom. I don't know who you were talking to today, but someone is listening and they're watching and saying, wow, I am so inspired. Just put a whole bow on this whole conversation.
Can I just tell y'all something? I'm just going to really quick. We didn't really talk about my background, but I want you guys to know, like, I'm a high school dropout, 17-year-old teenage mom. And it took me getting in the room. And I didn't realize it at 17 or 19 or 20 or 30, but I realize it now that I reflect back. Get in the room with people. They will open up your eyes to so much more than you could even imagine. If you don't take that step, I promise you this time next year, you will be wishing you took that step a year ago. So like, you have to take the steps and just understand you will not be comfortable. Get comfortable with being uncomfortable. That's where the growth is. So you're not going to be comfortable, but you got to get in these rooms. And if it means paying to get in the rooms, pay to get in the rooms. That's my advice.
There it is. Listen, we cannot close it out no better than that, man. Do yourself a favor. Go follow Dr. K. I know I am. I need to be in one of these webinars because that might be a little side business that I can get going. That'd be litty. And then go get you some social proof, meaning go build something, but then you got to come back to your community like Dr. K is doing and teaching other people how to do the thing that you did. It's the only way our community grows and becomes empowered. All right, we are out of here. Peace.